Growing up, I faced a variety of health issues that, while they persisted through my childhood and adolescence, they actually didn't really get cured or really diminish until my college years. And I really didn't really think about what trust meant in those relationships and how that manifested throughout my childhood. But now, just sitting here and thinking about trust, how it's so important to have that trustful relationship between patients and providers and how much that means to me today. And I use my own personal experiences to pursue a career in medicine in the future, starting next year. But one of the first times that I was able to see trust was when I went to the Dominican Republic on a medical outreach internship during my college years. And on the left picture, you can see me with one of the patients. I'm doing her blood glucose there. And on the right side, we taught classes on dental hygiene to young students at a local school in the DR. But what I really saw in the country when we set up these clinics throughout some of the most destitute areas of the country was that despite the fact that they did not have access to a lot of the medications or to health education, what they did have was that trust. And that's trust in the local physicians there, but also in the nurses there, and just in the health system in general, and how important that was to have this trust. And so when we had these clinics there, we gave free medications and we provided physical examinations for the patients there. But what really made those sustainable health changes and really made us able to make a large impact for the patients there was, again, that trusting relationship. And this is kind of where I cemented my desire to be a physician, but also to continue the research efforts that kind of came after my time in the DR. So I started a project where I tried to see how migration and individuals living in Spanish-speaking countries, what that really meant for their health and their health care. And a lot of times I found that through interviews, but also through analysis of the medical records of these individuals, that sometimes because of that migration, they don't have a lasting relationship with their physicians. And because they don't have this lasting relationship with their physicians, they're not able to have those health outcomes that they could if they had that longevity within their relationship with their patients.